Hey, in this video, I will tell you about the treatment of type 2 diabetes. Let's move toward the treatment of diabetes. Number 1. Lifestyle modification. Dietary changes. Adopt a balanced diet with an emphasis on portion control and carbohydrate management. Number 2 is exercise. Regular physical activity is crucial for managing blood sugar levels and improving insulin sensitivity. Number 4 is injectable medication. GLP-1 receptor agonists. These medications stimulate insulin release and reduce glucose production. Number 5 is oral medication. Various oral medications such as metformin, sulfonylureas, and other help blood sugar levels and improve insulin action. Number 6 is insulin therapy. In some cases, insulin injections may be prescribed either alone or in combination with oral medications. Number 6 is blood sugar monitoring. Regular monitoring helps individuals and healthcare providers assesses the effectiveness of treatment and make necessary adjustments. Number 7 is weight management. Achieve and maintain a healthy weight, as weight loss can significantly improve insulin sensitivity. Number 8 is individualized treatment plans. Treatment plans are tailored to each individual, considering factors such as age, overall health, and lifestyles. Number 9 is regular medical checkups. Routine checkups with healthcare providers help monitor overall health, detect potential complications early, and adjust treatment. Number 10 is education and sport. Diabetes education and sport groups play a crucial role in helping individuals managing their conditions effectively. Type 2 diabetes involves a logistic approach combining lifestyle changes, medications, and regular monitoring. Preventive efforts focus on promoting a healthy lifestyle and managing risk factors to reduce the likelihood of developing the condition. Stay happy, stay healthy, stay safe.